Well, a group of health-related professionals has formed an alliance concerned about access to vaccines across the country. Public health physician and co-chair of the Adult Vaccine Alliance, Dr. Jia Hu, joins us this morning. Thanks for taking time for us, Jia. We appreciate it. And when I say a group, I mean this is a real range of members and different folks from different backgrounds that are involved with this.
Yeah, absolutely. So folks like myself in public health and other physicians, people in pharmacy, people from industry and patient advocacy organizations, because I think you kind of want the whole gamut of people involved in vaccination to really try to increase uptake.
And so why was it determined that it was needed?
I think that, while a lot of us sort of recognize the importance of pediatric vaccines for kids, I think there's less awareness around the importance of adult vaccines. I think we've all sort of heard of COVID and flu, and, certainly I don't think uptake for those is going to be super high this year. But there's a lot of other adult vaccines, such as, shingles and pneumonia vaccine, and RSV vaccine, and more on the way, that, really do help prevent hospitalizations and death in adults and older Canadians. And I think it's really important that, this group actually also get vaccinated as well.
And so the goal then is that the main piece of it, is the sort of education piece?
That's one of it. I mean, I think when we think about sort of why vaccine uptake in this population is sometimes lower, education is certainly part of it. Yeah, another is just around, funding and access. Right now, the National Advisory Committee on Immunization makes a lot of recommendations, very good recommendations on vaccines. But just because a vaccine is recommended, like the shingles vaccine, doesn't necessarily mean it's funded. And so, I think these things aren't necessarily cheap. And so I think what we want is to make sure that, what public health has recommended is sort of free for Canadians across the country, which isn't the case now. We want to make sure they're accessible, easily accessible. And, that could mean being available at public health, doctor's office, pharmacy, sort of depends where. And of course, the education piece is always going to be really, really important as well.
Yeah, let's stay with that. You mentioned COVID, and obviously the pandemic had a huge impact on sort of public perception of vaccines, very heated debate around that. I'm just wondering, how does that debate and the sort of mis and disinformation that went on during that period, how does that make your group's job harder?
Yeah, I think we've certainly seen since COVID, as you say, a lot more misinformation and disinformation. If we kind of look at global survey data, much of it sort of extends to Canada, there has been probably a slight decrease in confidence around all vaccines. And I think, with adult vaccines, where your uptake rates are probably in the 50s and the 60s as opposed to the 80s and 90s for kids, this is really significant. And so, again, that's sort of one of the reasons why sort of our coalition formed. I think it's important to have a diverse membership, a diverse group of sort of experts or participants in the vaccine field to sort of contend with some of this. Because, if we don't address this, I think that ultimately vaccine uptake will fall, and nobody wants that.
And how much more of a challenge do you think it will be here in Alberta? Obviously, this is your neck of the woods, and you were here throughout the pandemic. I'm wondering, how much more difficult do you think that will be here in our province compared to others?
Yeah, I think it's been a bit more challenging in Alberta. Even if you just look at uptake of, COVID and flu vaccines compared to other jurisdictions, I think that, of course, when that happens, it's more important than ever for us to sort of work together to sort of increase that uptake. But there's so many factors that drive that. And that's why I think initiatives like the Adult Vaccine Alliance that sort of work on, funding and access and education as well are super important.
Okay, we'll continue to follow the Alliance, and thanks for taking time for us this morning. That is co-chair of the Adult Vaccine Alliance, Dr. Jia Hu.